Priscilla, you may begin your presentation.
Thank you so much, Connie. As you can all see, we will be using Poll Everywhere throughout the presentation for attendees to participate in live polling and see the results. It will help us get a better understanding of where each of you as participants are and with your understanding of the Promoting Interoperability program. So please you can use your computer or you can use your phone to participate in these live polls. So please follow the instructions below so you can participate in the live polls by activating your mobile device or computer. So there are two ways to join. On the left-hand side, you can see that you can use your computer. So go to any web, go to the pollev.com and enter EO program 753, and it will take you to when we activate the live polling questions. Or you can join through the second route, which is through your phone, so by texting. You will text EO program 753, and you'll text that to the number 22333. So you can do that through your phone to participate. And as we do the polling questions, I will go over these instructions again to help you. Next slide. So this is just a test. So what is your favorite color? So feel free to text 22333 and type in EO program 753 to start the texting to put in your favorite color. So once you text that EO program 753, it should say that you can start the polling, and then you can type in your favorite color. Same thing for if you're using your computer. You go to pollev.com/EO program 753, and you can type in your favorite color. Okay, I see a few people have participated in that, so feel free to do either of those. This is just a test. So we'll move on to the next slide to start the presentation and discuss clinical quality measures for Program Year 2020 Meaningful Use. Next slide. So there are 3 learning objectives that we will be discussing during today's webinar. The first one is to know the clinical quality measure requirements for the Medicaid Promoting Interoperability, otherwise known as the PI program. The second learning objective is to understand the CQM documentation requirements, and the third objective is to learn what resources are available to help you determine the appropriate CQMs to report on. Next slide. So what is electronic clinical quality measure? The eCQMs use data electronically extracted from the Certified Electronic Health Records Technology, otherwise known as CERT, and Health Information Technology systems to measure the quality of healthcare provided. The Centers for Medicare and Medicaid Services, otherwise known as CMS, uses eCQMs in a variety of quality reporting and value-based purchasing programs. Hospitals, professionals, and clinicians use eCQMs to provide feedback on their care systems and to help them identify opportunities for clinical quality improvement. eCQMs are also used in reporting to CMS, the Joint Commission, and commercial insurance payers in programs that reimburse providers based on quality reporting. Next slide. So what are the reporting similarities between PI and other programs? CMS has updated eCQMs for potential inclusion in the following programs for EPs. For the Quality Payment Program, which includes the Advanced Alternative Payment Models and the Merit-Based Incentive Payment System. Other programs that they are lining them up with is the Advanced APM, which is the Comprehensive Primary Care Plus program, and the Medicaid PI program, which we will be focusing on during today's presentation. Next slide. eCQMs support achievement of healthcare goals. So there's 3 main goals in place that they're trying to achieve: better health, better healthcare, and lower costs. So first, we're going to discuss the better health. So it's to promote evidence-based clinical processes, measure preventing and treating priority conditions, and to improve outcomes by identifying deficiencies in safety and accessibility. The second goal is for better healthcare. It's to help reduce provider burden and administrative time by streamlining measurement. It's to improve functional assessment of chronic conditions, and it's to facilitate care coordination across settings. The third goal is to lower costs. It's to reduce preventable hospital readmissions, decrease medication errors, and promote appropriate usage of diagnostic testing and screening. Next slide. CMS Guidance. CMS is moving from having each EP simply report eCQMs to having each EP's performance assessed based on the reported eCQMs. CMS is urging Medicaid providers to choose measures aligned with their practice. The agency advises reporting on measures containing numerators and denominators before reporting measures containing errors. Next slide. So here's our first polling question. Keep in mind at the top of the screen it shows you how you can use the first line, explains where to go to start to enter in answers. And then the second line is to use your phone. And so the question is, if possible, should one of the 6 attested eCQMs be an outcome measure? And we'll give you all a few minutes to enter in your answers. So if you are texting, you want to put A for yes, B for no, and C for unsure. So if you don't know, give it your best guess so we can have an idea of where you're at with understanding the requirements of the Program Year 2020 eCQM requirements. I'll give you a little bit more time. Okay, about 15 more seconds to enter in your answers. Okay, so the correct answer is yes. So if possible, one of the 6 attested eCQMs should be an outcome measure. So each EP must attest to 6 eCQMs to meet the requirements for CQM. And so if possible, it needs to be one outcome measure. We are going to discuss a little later if a CQM that an EP is able to report on is not an outcome measure that's related, like that CQM is not related to their practice and what they do and the types of patients they see. It is possible to still meet the requirements, and one of those 6 eCQMs are not an outcome measure, but CMS does recommend that if possible, one of your 6 should be an outcome measure. Next slide. So here are the requirements and the definition of the eCQM for the PI program. EPs must attest to 6 out of 47 available eCQMs. 6 are outcome measures, 27 are high priority measures, and then there's 14 remaining eCQMs. So the first priority and recommendation from CMS is that if relevant, at least one eCQM should be an outcome measure. However, if that's not possible because the outcome CQMs are not relevant to that specific provider and the patients they see, they should move down to priority level 2. And priority level 2 is if no outcome measure is relevant, at least one eCQM should be a high priority measure. However, if that's not possible and those high priority eCQMs are not relevant to the provider either, then they should move down to priority level 3, which is if no outcome or high priority measures are relevant, report on relevant measures if possible. Okay, but keep in mind that all providers must attest to at least 6 eCQMs. Next slide. So here's another polling question. How long is the eCQM reporting period for Program Year 2020? Is it A, the eCQM reporting period is 365 days for all EPs? Is it B, the eCQM reporting period is 90 days for EPs attesting to their first year of MU and 365 days for returning EPs? Is it C, the eCQM reporting period is 90 days for all EPs? Or D, is it unsure? So go ahead and put in your answers, either A, B, C, or D. I'll give you about 30 seconds, maybe 45 seconds to respond to this poll. And keep in mind, try to put in the best answer possible because that's going to help us gauge where y'all are at and how we can best address the confusion with the program. Again, we're asking how long is the eCQM reporting period for Program Year 2020? at the top of the slide does show you and explain to you where to go if you're using your computer versus if you're using your phone. Give you just a few more seconds to enter in those last minute answers. Okay, so the correct answer for this is C. The eCQM reporting period is 90 days for all EPs. And there can definitely be some confusion because in program year 2019, it was B. So the eCQM reporting period was 90 days for EPs attesting to their first year of MU and 365 days for returning EPs. But that was only in program year 2019. In program year 2020, CMS wanted to align and make it easier for these EPs when they were coming in and attesting towards the end of the program. And so they made it to where the eCQM reporting period is 90 days for all EPs. Even if the EP is attesting to their first year of MU, it is still 90 days in program year 2020. So as you're attesting to the different program years, make sure you're looking at the right requirements for the correct program year you're attesting to. So it's 90 days for program year 2020. Next slide. As established in the Physician Fee Schedule Rule, high priority measures for the PI program are determined via 3 methods. 1, high priority measures under MIT. 2, measures included in the adult and child core sets. And 3, any additional measures selected by individual states. Keep in mind that Arizona has not selected any additional high priority eCQMs. So the only high priority eCQMs out there are the high priority measures under the MIT program and measures included in the adult and child core set. And we will point out the specific eCQMs that are high priority measures later on in the presentation. EPs must report on the most recent version of each eCQM available in the CERT. The eCQM reporting period is 90 days for all EPs, and the reporting period must be within calendar year 2020. Next slide. So what is the distinction between CQM and eCQM? CQMs can be calculated outside of the CERT, so via a chart abstraction. So it's done potentially manually outside the CERT, done through a different system that's not inside the CERT. eCQMs are CQMs calculated electronically by the CERT. So the phrase eCQM does not indicate the data was transmitted electronically, just that it was electronically calculated by the CERT. eCQMs can be calculated electronically by CERT and still transmitted to the agency manually via attestation and EPIP. So the CERT's calculating all these eCQMs, and when you pull that report out of the CERT, it's okay to manually submit it during attestation. All CQMs reported for purposes of the PI program must be calculated by the CERT. Therefore, the terms eCQM and CQM are used interchangeably for the PI program in many CMS resources. Next slide. So let's discuss the adult and child core measure sets. CMS identified 2 recommended core sets of eCQMs, one for adults and one for children. We encourage EPs to report from the recommended core set to the extent those eCQMs are applicable to the EP's scope of practice and patient population. CMS selected the recommended core set of eCQMs for EPs based on analysis of several factors. The conditions that contribute to the morbidity and mortality of the most Medicare and Medicaid beneficiaries, conditions that represent national public health priorities, other conditions that are common to health disparities, conditions that disproportionately drive healthcare costs and could improve with better quality measurement, measures that would enable CMS, states, and the provider community to measure quality of care in new dimensions with a stronger focus on parsimonious, which is the simplest model with the least assumptions or variables, but with the greatest explanatory power measurement. And also measures that include patient and or caregiver engagement. So as you can see, CMS was very careful in setting and recommending the core set of eCQMs for EPs. At the bottom of this slide, which we will not click on, but there are 2 links that take you to the adult core eCQMs and the child core eCQMs reports, and so you can see those lists separated out. This presentation will be shared with you after concluded, and it will be on the Health Current and Access website. So down the road, if you do want to look at those reports and which ones are adult versus child core eCQMs, you can click on those links. Next slide. So outcome measures, at least one of the reported eCQMs must be an outcome measure. We've identified those outcome measures, and keep in mind that there are 6 CQMs. So CMS 75, CMS 122, CMS 133, CMS 159, CMS 165, and CMS 771. Those are the 6 outcome measures, and you can see in this table on the left-hand side, it has the CMS number, and then it goes into the eCQM ID, and then it goes into the middle column, which is the eCQM title, and then some of these CQMs have NQF numbers. So there's multiple ways to look up these different CQMs depending on what identifier you need. And then the last column, it says core set, and throughout these next couple slides, we're going to show you all 47 CQMs. It does identify whether it's adult or child core CQM. So keep in mind that if you do need just an overview of all 47 CQMs, you can pull up this presentation and look at it. Next slide. So high priority measures. If no outcome measures are relevant to the EP scope of practice, the EP must report on at least one high priority measure. So this in the next slide is going to identify all the high priority CQM measures. It's the same table formatting. It lists out each of those CQMs. As you can see, I just want to point this out, and we'll discuss this in more detail a little bit later. But in that second column, the eCQM ID, it identifies that CMS, in that first row, CMS 2 version 9. So as we go throughout this program, these CQMs have been updated based on the version number. And sometimes the certs do not always have the most updated version number. So some of your certs may have the CQM CMS 2 for providers to input information into for their patients. However, it may be version 8 or version 7 instead of version 9. So keep that in mind, and it's okay if your cert does not have the latest version that CMS has identified and updated. Just as long as your cert that you're attesting to that specific CQM, as long as the cert can electronically pull the numerator and denominator for that CQM, it's okay if it's an older version. So this is just part of the high priority measures. We'll go on to the next slide, and you'll see more high priority measures. And so it's continuing, it's just listing out more. It explains the title, so keep in mind that if it's not relevant to the provider's practice, you may want to attest to a CQM that is relevant to the provider. So for example, that second row, CMS 146, appropriate testing for children with pharyngitis. If you're not a pediatrician, the provider's not a pediatrician, that may not be relevant to the provider's practice. So if possible, as you're attesting to the PI program, you want to make sure, or at least try to attest to CQMs that are relevant to your scope of practice. Next slide. Here's the remaining list of high priority measures. Keep in mind that if no high priority measures are relevant to the EP scope of practice, the EP may report on any 6 relevant measures. So as the total 47, just try to attest to ones that are relevant. There is a link at the bottom of that slide which takes you to a list of all the eCQMs, and it identifies which ones are high priority. So if you are wondering and you want to look at it in a different format, you can go there. It, as said in this slide and the previous 2 slides, it does list all the high priority eCQMs. This link that you can go to, CMS has not updated the list for program year 2020. However, there were no changes to the high priority measures. So when you click on that link, it is going to show for 2019, but again, there were no changes to the high priority measures. So that list is still active and relevant. Next slide. For purposes of the PI program, the eCQMs are calculated from the total patient population or subsets of the patient population based on age, condition, and among other factors. Data is not limited by payer. So it's not just Medicaid patients that are in the calculations for the eCQM. It should be the total patient population, or for some CQMs, a subset of the patient population. So for children with pharyngitis that we discussed earlier, that would only show up for, kids of certain ages because it's specifically talking about children. Next slide. So here's an example of eCQMs for EP, so breast cancer screening, which is CMS 125 version 8. And again, your cert could have an older version in your system, and that's okay. Percentage of women 50 to 74 years of age who had a mammogram to screen for breast cancer. So those would be the patients that are in the numerator. There is a link which takes you to the measure specification, so it takes you to the CMS eCQM website, and it just discusses in detail what might go into the numerator versus the denominator. So if you want more details, you're able to go to that website. It does also list all the other CQMs on that website, so you can look at the measure specifications and the details behind what patients would go into the numerator for that CQM and what patients would go into the denominator. The second example is diabetes, which is hemoglobin A1C, poor control, which is greater than 9%, and this is CQM 122 version 8. And it's a percentage of patients 18 to 75 years of age with diabetes who had hemoglobin A1C greater than 9% during the measurement period. So that numerator, it's not going to be the total patient population, but it's going to be patients 18 to 75 years of age with diabetes who had that hemoglobin at that certain level or higher, and it'd be during that 90-day reporting period. So keep in mind your eCQM reporting period is 90 days. So that numerator and denominator is only going to include patients that were seen in that 90-day window. Again, there's another link that takes you directly to the website if you want to look in more detail at this CQM. Next slide. Here's another example, which is the antidepressant medication management, which is CMS 128 version 8, which is a percentage of patients 18 years of age and older who were treated with antidepressant medication, had a diagnosis of major depression, and who remained on an antidepressant medication treatment. Two rates are reported. So the first one is the percentage of patients who remained on an antidepressant medication for at least 84 days, which is 12 weeks. And then B, percentage of patients who remained on antidepressant medication for at least 180 days, which is 6 months. And at the bottom is the hyperlink, which takes you to the website, and it explains and breaks down each rate and which one goes into A. So there's technically going to be two smaller measures underneath this eCQM 128. And so there's going to be A, which is that percentage of patients who remained on antidepressants for at least 84 days. So there's going to be a numerator and a denominator for that, and a percentage. And then for that second one, which is B, the percentage of patients who remained on antidepressant medication for at least 180 days, there's going to be a numerator, denominator, and a percentage for that eCQM. So it's kind of two parts underneath this one eCQM. Even though there are two parts, that still counts as one CQM. So you still have to attest to 5 other CQMs to meet the requirements of the program. Next slide. Here's another poll. Does the EP's 2015 edition cert have to be able to calculate all 47 eCQMs? So an EP is attesting is the 2015 cert that they should have implemented for program year 2020 have to calculate all 47 or maybe just the 6 that you have to attest to. So click A or text A for yes, B for no, and C for unsure. And I'm going to give you about 30 seconds to respond to this poll. Give you a few more seconds to input your answers. At the top of the slide, it does show the first line, how to respond to the program, the polling questions via your computer, and then the bottom one is in regards to if you're using your mobile device. Maybe about 5 to 10 more seconds to put in your answers, and then we'll go over what the correct answer is. Okay, so does the EP's 2015 edition cert have to be able to calculate all 47 eCQMs? So I see 33% of you put B for no, it does not, and then C for unsure. So you are correct if you put no. The EP's 2015 edition cert does not have to calculate all 47 eCQMs. So it is okay if your cert only has 10 possible eCQMs for you to attest to. However, out of those 10, you want to make sure you attest to the most relevant eCQMs that are in your cert that you're able to attest to. So just make sure what you're attesting to lines up with what your cert is capable of producing. Also, to be able to meet the requirements of the program, your cert does have to be able to electronically calculate at least 6 eCQMs. So those, because you have to attest to 6 CQMs, which means your cert needs to be able to calculate and pull that into a report for you to submit during attestation. Next slide. The provider's 2015 edition cert must be used to calculate eCQMs for program year 2020. Certs may not be certified to calculate all 47 eCQMs. Providers should check to see which eCQMs their cert is capable of calculating and select those that are relevant to their practice. If there is not a relevant eCQM that the cert is certified to capture, EP should report on what their cert is capable of calculating. So before you go to a test, you should go in and check to make sure your cert is calculating at least 6 electronically. If the older version of a particular eCQM does not match the EPIP layout, for example, the older version has multiple parts, but there is only one numerator or denominator space in EPIP, the EP should enter the numerator and denominators from the dashboard as closely as possible. So a few slides back, we were discussing where there was an eCQM that had 2 parts to it, and I believe it was version 8 for that CQM. So if the EPIP system, so say they have 2 parts in it, so they have underneath that one CQM that you're attesting to, they're like, hey, part A, there's a numerator, denominator, and percentage, and you need to input that into EPIP. And then for part B, it has the same thing. But say your version of that CQM is version 6 and not version 8, which matches program year 2020. And for example, say version 6 only has part A. There's no part B in your system. Input that part A in there and then leave part B blank because you don't have that part. So you can still attest with that CQM because you have the most updated version for your cert, even though EPIP may be showing a different version, which may have a different format. So keep that in mind as you're attesting. Try to, as closely as possible, attest to the numerator and denominators from your dashboard for your CQM report. Next slide. So here's another polling question. Must the eCQM report show that it was pulled from the practices 2015 edition cert? So A is yes, B is no, and C is unsure. And at the top of the slide, it does show how to use it if you're using your computer. Go to pollev.com/EOprogram753 and input your answers, A, B, or C. And if you're using your mobile device, text the number 22333 and text EOprogram753. You only have to do that the first time you are answering the poll, and then you can input A, B, or C each time that polling question comes up. So must the eCQM report show that it was pulled from the practices 2015 edition cert? I'll give you about 10, 15 more seconds to input your answers. A for yes, B for no, and C for unsure. Okay, so y'all answered yes, 33% of you answered yes, that the eCQM report should show that it was pulled from the practices 2015 edition cert. And you would be correct. So when you're pulling that CQM report, you need to make sure that it shows it was pulled from the cert. Because if you produce an Excel file that lists out the 6 eCQMs you attested to, we don't know that Excel file was pulled from the cert. So in that example, when you pulled that Excel file, you may need to take a screenshot of how you generated the report and type of an explanation of, you put in from your screenshot, explain what everything is showing and what button you clicked to produce that Excel file. Another example is if your CQMs are in your cert and so you're screenshotting to show the numerator and denominator of your eCQM, make sure you get the entire screen that shows you're inside your cert, that shows that you're inside EPIC or Athena or eClinicalWorks, depending on what type of cert you have. Next slide. So let's discuss the documentation that's required when attesting to the program for eCQM. So you need to run that eCQM report from the cert for the appropriate reporting period, which is 90 days. You need to prove the eCQM data was calculated by the 2015 edition cert. There are two different examples that we've named here. So the report must show the cert name/edition or screenshots demonstrating how the report was pulled from cert. So either one of those would potentially be sufficient for you to submit with your CQM report. So the CQM report must include the following. It must include the required number and type of eCQMs. It must include the numerator and denominator for each CQM. It must include the most recent eCQM version the cert has available. And then it must show the proper reporting period, which is the eCQM reporting period is 90 days for all EPs, and it must be within calendar year 2020. So all of those items need to be shown in that report that you submit during attestation. Otherwise, the access staff may reach out to you and request sufficient documentation that shows all those items, that shows that there are 6 eCQMs in the report, that it shows the numerator and denominator, it shows the most recent eCQM version, it shows the 90 days you pulled that report for, and it must show that the CQM data was calculated by the 2015 edition cert. Next slide. So we're going to discuss the audit findings and just what you can expect during an audit. Next slide. So all providers that receive a Medicaid PI incentive payment could potentially be selected by Access for post-payment audit. If selected, Access post-payment analysts will conduct a thorough review of the documentation attached to the EP's attestation and EPIP to determine if it meets the program requirements. Access may have follow-up questions or make additional documentation requests. So as you're collecting data and attesting, make sure to upload it into EPIP so that those post-payment analysts have those documents ahead of time and they may not have to request as many documents or as many follow-up questions. Next slide. Some common audit findings that we have discovered over the years is the eCQM report does not show it was pulled from the practices cert, failure to maintain documentation, and the practice no longer has access to the cert. Another common finding is reporting eCQMs for the wrong reporting period. So it may be for a 90-day reporting period back in 2019 or in 2021 as we get to that year, like it showed for a different year than what is needed. And then it's also showing for 365 days versus a 90-day reporting period. Also including data for the entire practice in the reported eCQMs rather than data for the individual EP. And then the last common finding that we usually discover is not uploading the eCQM report when attesting for a payment. So just make sure to be proactive and upload your eCQM reports to EPIP. Keep in mind that all of these common audit findings, they're not the only audit findings that have been discovered, so there could be other potentials. These are just the ones we see most often. Next slide. So here are some resources, and each of these are hyperlinks, as you can see. So when this presentation is emailed out to all the participants of this webinar, and it will be put on the Health Current and Access website, you can click on each of these hyperlinks, and all the information throughout this presentation were pulled from one of those links. And so as you can see at the top, we have the EP eCQI Resource Center, which is where it shows the measure specifications for each CQM. And so it shows what should go in the numerator versus denominator. Also, we have the CMS eCQM tip sheet, which is on the CMS website, so you can just click on that. It takes you straight to that website. We also pulled information from the federal final rule for modified stage 2 and stage 3. Also, the physician fee schedule for program year 2020, the adult and child court eCQMs, which we've referenced throughout this presentation. There's also a list of the 2020 eCQMs that CMS put out, so it shows all 47. And then that last hyperlink takes you to the Access website, which is where in the next week or two the frequently asked questions document that we prepared for this webinar and this presentation will be posted to that website. And so that link takes you straight to the website, which shows all the educational resources that Access has provided for the different requirements of the PI program. Next slide. Here's just some contact information. If you have any questions, we are going to be taking questions at the end of this presentation, which we're about to wrap up. So if you do have any questions, go ahead and start putting them in the chat box, and I can answer those questions. But here is contact information if you have questions after this webinar is concluded or at any point while you're attesting to this program, or if you're considering attesting to the program, feel free to reach out to Access or Health Current. The emails and the phone numbers for both of those organizations are listed there, so feel free to reach out to them if you have any questions, or if you have a specific question from this webinar, definitely let them know, and if they need any information from me, they will definitely reach out to Myers and Stauffer. Next slide. Okay, so if you do have any questions from any of the information we've covered in today's presentation, please feel free to put that question in the chat box. And while we're waiting for y'all to put in any questions you may have, we did create a frequently asked questions document. And so we're just going to kind of go through these questions and provide the answers to each of these questions. So if this does, if you have a question because we're going over these questions, like something that leads into another question, definitely feel free to put that in the chat box and I will answer that question. So the first one is just, what is electronic clinical quality measure? So eCQM use data electronically extracted from the CERT and or health information technology systems to measure the quality of healthcare provided. The Centers for Medicare and Medicaid Services use eCQMs in a variety of quality reporting and value-based purchasing programs. The second question is, what is the difference between a CQM and an eCQM? A CQM can be calculated outside of the CERT, whereas eCQMs are calculated electronically by the CERT. The phrase eCQM does not indicate the data was transmitted electronically. An eCQM can be calculated electronically by CERT and still transmitted to the agency manually via attestation in EPIP. All CQMs reported for the purposes of the PI program must be calculated by the CERT. Although the terms eCQM and CQM are used interchangeably for the PI program, only CQMs generated by the CERT are accepted as sufficient for the program. Moving on to the third question, where can I find the eCQMs I can report for each program year? So you can go to the eCQI Resource Center, and there's a link right there. And you want to select the appropriate year from the Select Performance/Reporting Period drop-down menu, and then click on the Apply button. So it kind of walks you step-by-step instructions when you pull up that website. And you'll scroll down past the list of eCQM materials to see the available measures. Also, to download a complete list of the eCQMs from that same website, you will select the link that says Eligible Clinicians and Eligible Professionals table of eCQMs to see a printable list of the available measures. Also, you want to check your CERT to determine which of the measures are available in your system. So you can use, from that question 3, you can use those steps to find that list, or you can also pull up the presentation from today, which lists out every single CQM for program year 2020. Question 4 is, how many eCQMs must the EP report on for program year 2020? An EP must attest to 6 out of the 47 available eCQMs. We recommend that the EP run a complete eCQM report from his or her CERT in case of vendor or other issues. EPIP will only allow the EP to attest to exactly 6 eCQMs. However, the CERT eCQM report contains more than 6 eCQMs. So as you're attesting an EPIP, you can only input 6 of those, but your PDF or your Word file that lists your CQM report, it can contain all 47 if your CERT is capable of producing that report. So it's better to be safe than sorry, and just go ahead and upload that full report. So if something does happen as your attestation is being reviewed, and maybe something happened with those 6 or you input the wrong data, we can see your entire report. At the bottom of each page, you will see these links. So that will take you to different websites to provide just more additional information. So a list of all the eCQMs, and then the adult and child core eCQMs. Moving to question 5, what is an outcome measure? An outcome measure is a high-level clinical measure used to measure a change in the health of patients. Some of the outcome measures for 2020 focus on diabetes, cataracts, high blood pressure, and dental decay in children. An outcome measure is different from a process measure, which measures a specific healthcare process, such as screenings and monitoring of patients. For program year 2020, there are 6 outcome eCQMs. Question 6, what if no outcome measures are relevant to the eligible professional? The answer is that an EP must attest to at least one outcome measure unless no outcome measures are relevant to the EP. In this case, the EP must report on at least one high priority measure. I see in the chat box that there are no questions as of yet, but if you do have any questions, please go ahead and input that question into the chat box, and I can answer whatever questions you may have. Question 7 is, what is a high priority measure? The answer is that CMS has flagged certain eCQMs as high priority. Their measures focus on specific health conditions that represent national public health priorities. Question 8, what if no high priority measures are relevant to the EP? The answer is that if no high priority measures are relevant to the EP scope of practice, the EP may report on any 6 relevant measures. Question 9, what if the EP cert is not certified to capture the most relevant eCQM? For providers' EHR technology to be certified, the Office of the National Coordinator, which is called ONC, which is the agency would certify that an EHR solution meets the PI incentive program requirements. So the ONC requires the EHR technology solution to support a provider that is reporting its eCQMs for MU purposes. However, ONC allows vendors to certify selectively which eCQMs their software will support. This means it is very important for a provider to understand which eCQMs a cert will support. Depending on the population a provider serves, the provider may find that some certs may not support the reporting of an eCQMs applicable to that practice. So the ONC certifies that EHR technology to meet the PI incentive program requirements. However, ONC does not enforce each cert to report on all 47 or to allow their providers that are using the EHR technology to have access to using all 47 or even all 6 outcome measures. So just keep that in mind that whatever cert you're using, go ahead and look at what CQMs you're able to report on to see which ones are relevant. If there is not a relevant eCQM that the cert is certified to capture, the EP is able to report on what the cert is capable of calculating. Okay, so just because they don't have the relevant eCQMs for you does not mean you're not capable of meeting the requirements of the program. Just report on the ones that are available to the cert. Question 11, does the state of Arizona have any additional high priority eCQMs? The answer is that Arizona has not selected any additional high priority eCQMs. An EP should only use a list of 27 eCQMs that CMS identified as high priority. Question 12, how long is the eCQM reporting period for program year 2020? The eCQM reporting period for program year 2020 is 90 days for all EPs. The eCQM reporting period must be within calendar year 2020. Question 13, does the eCQM report have to come from the cert? Yes, the numerator and denominator information for eCQMs must be reported directly from the cert report. Question 14, how do I run an eCQM report from the cert? If the EP does not know how to pull the eCQM report directly from the cert, the EP should contact the cert vendor and request guidance. Moving on to question 15, how should a provider who upgrades from a 2015 edition cert to a 2015 edition cert or changes cert vendors report during the 90-day eCQM reporting period in 2020? So how do you need to report that if you changed cert vendors during that 90-day eCQM reporting period, or if you upgraded from 2014 to 2015 edition cert? The answer is that an EP does not need to have 2015 edition cert by the beginning of calendar year 2020 or by the beginning of the eCQM reporting period. The data that Medicaid EPs are required to report for eCQMs is a snapshot based on the data within the cert, taken between the end of the PI reporting period and the date of attestation for the reporting period. So the first one is EPs have a 2014 edition cert during the eCQM reporting period and upgrade to the 2015 edition of the same cert prior to attestation. So the data supporting eCQMs is entered into the EP cert during the regular course of business and will be stored in the cert. The cert should retain the data entered in the 2014 edition within the upgraded 2015 edition. So it should be able to transfer over. The EP should generate an eCQM report between the end of the PI reporting period and the date of attestation, and this report will calculate the eCQMs based on the data entered during that PI reporting period. So for this first example, as you're switching from a 2014 edition and upgrading to that 2015 edition cert, you should at the end of the eCQM reporting period be able to pull one report. But keep in mind that these certified electronic health record technology systems, if there is an error or something like that, immediately reach out to your vendor and ask them what is going on. But this is how your system should be working. The second example is EPs that change vendors or practices during the reporting period. So in that scenario, the EP must provide two reports, one from each system or location, to show the reported eCQM from both certs or both locations. Both reports should cover the entire PI reporting period, that 90-day period. The numerator from both reports should be added together to determine the numerator entered into EPIP, and the denominators from both reports should be added together to determine the denominator entered into EPIP. So you would look at both reports and you would take the numerator from the first report and the numerator from the second report and add those together and attest in EPIP for that. And the same thing goes for the denominator. Moving on to the next question. So question 16, the eCQM specifications are updated each year. Which year's specifications or versions will Arizona accept from providers? The answer is that vendors are not required to update CERT each year to the latest eCQM specifications in order to retain their 2015 edition certification. Therefore, it is possible that Medicaid providers will have CERT that produce eCQM specified to a variety of years. Arizona will accept the most recent version for each eCQM. Arizona will allow providers to report on older versions if that is all the EP's 2015 edition cert is able to produce. If an older version does not match the EPIP layout, the EP should enter the numerator and denominators from the dashboard as close as possible. Keep in mind that if you do have any questions, please put them in the chat box. We have about 7 minutes left for this presentation, and we're going to finish out the remaining of these questions in the FAQ unless one of the participants has a specific question that I can answer. Question 17, for the Medicaid Promoting Interoperability Program, can I report an eCQM with a 0 result in the numerator and or denominator? The answer is that a 0 result in the numerator and or denominator may indicate the eCQM is not relevant to the EP scope of practice. While we strongly encourage providers to report relevant eCQMs, 0 is an acceptable result provided that this value was produced by a CERT. Question 18, why does CMS recommend EPs report from the adult and child core eCQM set? The answer is that core measures are national standards of care and treatment processes for common conditions. These processes are proven to reduce complications and lead to better patient outcomes. CMS selected the recommended core set of eCQMs for EPs based on analysis of several factors. First one being conditions that contribute to the morbidity and mortality of the most Medicare and Medicaid beneficiaries, conditions that represent national public health priorities or are common to health disparities, conditions that disproportionately drive healthcare costs and improve with better quality measurement, and even measures that will enable CMS, states, and the provider community to measure quality of care in new dimensions with a stronger focus on the simplest model with the least assumptions or variables, but with the greatest explanatory power measurement. And then also measures that include patient and or caregiver engagement. Moving on to question 19. Can I submit my eCQM in electronic format directly to the state? The answer is that Arizona is not currently able to accept electronic submissions of eCQMs. The eCQM report will need to be uploaded to ePIP during attestation. So pull that eCQM report from your cert and then upload that PDF or Word or even Excel into ePIP when you're attesting. Moving on to question 20. What is the difference between program years 2019 and 2020 for eCQM? The answer is that EPs were required to attest to 6 eCQMs in program year 2019. The required number of eCQMs remain the same for program year 2020, but the versions have been updated for program year 2020. The requirement to attest to at least one outcome measure in 2019 stayed the same in 2020. However, there were some CQMs that were removed and added. So the eCQM list below was added, that first bullet point was added for program year 2020. So CQM CMS 771 version 1 was not in program year 2019, but it was added for program year 2020. And then moving on down, the eCQMs listed up towards the bottom of question 20 were removed from program year 2020. So these CQMs, so CMS 160, CMS 82, CMS 52, and CMS 132 were available in program year 2019, but are no longer available in program year 2020 for providers who are testing to program year 2020. We just have a few more minutes left, so if you have any questions, please make sure to input those in the chat box. Question 21, which is our last question in this FAQ. What should an EP do if during the ePIP attestation process, the eCQM section does not allow the EP to report on the eCQM most relevant to your practice? The answer is that Access does not anticipate this occurring, but if it does, please email EHR incentive payments at azaccess.gov and alert them of this issue. The EP should continue to attest to the best of his or her ability, write a letter of explanation, and upload to ePIP if possible. So if you do come across, and this goes for any questions you may have during attestation or concerns, or if something potentially goes wrong, which we do not anticipate happening, you can reach out to Access via that email right there. And then also on the contact slide of the presentation that I went over earlier, you can reach out to Access via phone number or email that's listed on that presentation. If you have any questions, please input those into the chat box. We just have a few minutes left. Okay, Connie, I'll be handing the presentation back over to you. It seems that there are no questions, but again, if you have any questions, whether it be about any of the requirements of the program, please reach out to Health Current or Access and ask those questions.
All right. Well, thank you. Thank you very, very much, Priscilla, for the very informative presentation. It's really great. I loved it. And I think everyone that's participating will also enjoy it and use the information very, very well. So without any further ado, Sarah, I will let you close out the webinar.
Okay, thank you, Connie. I appreciate everybody attending today. Each of you who have registered and participated in today's webinar will receive a copy of the webinar slide deck and the QAs addressed during the call, which is going to be this QA form. And if you have any further questions, just let us know. We'll be happy to help. Thank you.